This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 psychiatry questions. Just a reminder that you can find these questions and many more at medprep2go.com. If you'd like to get involved in this project or have any feedback, please email me at ted.medprep2go@gmail.com. If you like what we're doing, please give us a review, subscribe to this podcast, and let your friends know about this project. All right, let's get started with the first question. A 44-year-old woman presents to her physician for worsening depressive symptoms over the past 6 weeks. She reports anhedonia, diminished concentration, a decrease in her appetite, and difficulty sleeping. She was diagnosed with major depressive disorder 2 years ago and has been treated with sertraline 50 milligrams daily, which she takes consistently. Vital signs are within normal limits. Physical examination reveals a flat affect and tearfulness during the clinical interview. A patient health questionnaire 9, PHQ-9, is administered and yields a score of 16. A previously documented score of 8 from 3 months ago is noted in her chart. Which of the following is the most important next step in management? A, add aripiprazole. B, add brexpiprazole. C, add lithium. D, increase the dose of sertraline. Or E, inquire about suicidal ideation. The correct answer is E, inquire about suicidal ideation. Any patient with acute worsening of previously controlled depressive symptoms should be assessed for suicidal ideation. Failing to inquire about suicidal ideation is a missed opportunity to intervene in a potentially life-threatening situation in this patient with worsening depression. Depression is the leading cause of disability in the United States among individuals aged 15 to 44 years and is a major risk factor for suicide. The United States Preventive Services Task Force, or USPSTF, recommends screening all patients for depression. Patients can be screened with validated questionnaires such as the PHQ-9. The PHQ-9 score ranges from 0 to 27, with a score of 5 to 9 being mild depression, 10 to 14 being moderate depression, 15 to 19 being moderate to severe depression, and 20 or more being severe depression. Answer choice A, add aripiprazole, is incorrect. Aripiprazole is a second-generation antipsychotic that has shown benefit as an adjunctive agent for acute treatment of non-psychotic major depression that does not respond adequately to antidepressant monotherapy. Screening for suicidal ideation is the most important next step in management before medication is added. Answer choice B, add brexpiprazole, is incorrect. Brexpiprazole is a second-generation antipsychotic that has shown benefit as an adjunctive agent for acute treatment of non-psychotic major depression that does not respond adequately to antidepressant therapy. Similarly to the previous explanation, screening for suicidal ideation is the most important next step in management before any additional medication is added. Answer choice C, add lithium, is incorrect. Lithium is mainly used to treat bipolar disorder, but can be used off-label, that is, it's not FDA approved, as an adjunctive medication for patients with unipolar depression who have not adequately responded to antidepressant therapy. However, just as in the previous explanations, screening for suicidal ideation is the next most important step before medication is added. Answer choice D, increase the dose of sertraline, is incorrect. Sertraline is a selective serotonin reuptake inhibitor that can be used to treat major depressive disorder, panic disorder, obsessive compulsive disorder, social anxiety disorder, and many other psychiatric illnesses. The dose of sertraline can be titrated up in this patient, but screening for suicidal ideation is the most important next step in management. The key learning point here: any patient with acute worsening of previously controlled depressive symptoms should be assessed for suicidal ideation. Question 2. A 52-year-old man presents to the physician for follow-up of persistent major depressive disorder. He is currently being treated with venlafaxine. He previously took fluoxetine titrated to the maximum dosage before it was tapered off owing to minimal response and sexual side effects. He also takes aripiprazole and receives psychotherapy. He reports no improvement in his symptoms, which do not include mania or hypomania. He has not had suicidal ideation. He has no other medical conditions and takes no other medications. Vital signs are within normal limits. He appears sad with a blunted affect. A PHQ-9, a Patient Health Questionnaire 9, for depression screening and severity monitoring reveals a score of 17, which is consistent with moderately severe depression, which is slightly worse from his previous scores. Which of the following is the most appropriate FDA-approved treatment for this patient? A, add intranasal esketamine. B, add lithium. C, add valproic acid. D, discontinue aripiprazole and initiate risperidone. Or E, discontinue venlafaxine and initiate paroxetine. The correct answer is A, add intranasal esketamine. Patients who have severe major depression that is unresponsive to combination oral therapy with a second-generation antidepressant and an atypical antipsychotic agent, as well as psychotherapy, are candidates for intranasal esketamine. Unlike most other antidepressant therapies, esketamine has an almost immediate effect on depression symptoms. In August 2020, esketamine was approved by the FDA with the added indication for the short-term treatment of suicidal thoughts. Esketamine must be administered intranasally in a physician's office under direct supervision, and treating physicians must be enrolled in an FDA-mandated Risk Evaluation and Mitigation Strategies, or REMS, program. Answer choice B, add lithium, is incorrect. Lithium is indicated for the treatment of bipolar I disorder and can be used as adjunctive therapy for unipolar depression, though this is an off-label use of the medication. Off-label meaning not FDA approved. Answer choice C, add valproic acid, is incorrect. Valproic acid is used for the treatment of bipolar disorder, certain seizure disorders, and migraine prevention, but it is not used to treat major depressive disorder. Answer choice D, discontinue aripiprazole and initiate risperidone, is incorrect. Risperidone is an antipsychotic agent that is not indicated for the treatment of major depressive disorder. Answer choice E, discontinue venlafaxine and initiate paroxetine, is incorrect. This patient's symptoms have already failed to respond to treatment with one selective serotonin reuptake inhibitor at maximum doses. In addition, the sexual side effects he experienced can occur with all SSRIs and are likely to recur with paroxetine. The key learning point here: treatment-resistant major depression can be treated with esketamine in conjunction with an oral antidepressant. Esketamine must be administered under the direct supervision of a healthcare provider.
This episode is brought to you by... Oops! I've got a box of Cheez-It crackers staring at me, and I just wanted that irresistible cheesy crunch. Sorry, that was a total snacksident. What was I supposed to be talking about? So salty, so crunchy, so cheesy. Whoops, lost my train of thought. I've heard of brain freeze, but brain cheese? I'll just have one more Cheez-It cracker, and then I'll get back to it.
Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration, and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
Question 3. A 22-year-old man is brought in by ambulance to the emergency department with profound rigidity and extreme agitation for the past 1 hour. His mother relays that the patient was previously well but woke up this morning feeling very hot with no symptomatic relief with acetaminophen. She recalls the patient visiting a psychiatrist 7 days ago following concerns that he could hear voices telling him to kill himself that no one else around him was able to hear. She is unsure of the outcome of this appointment. Vital signs are temperature 39.5 degrees Celsius, which is 103.1 degrees Fahrenheit, pulse 115 beats per minute, and respirations 22 per minute. Systolic blood pressure is noted to fluctuate between 133 millimeters of mercury and 160 millimeters of mercury. On physical examination, the patient appears diaphoretic and displays mutism. Neurological examination reveals generalized muscle rigidity and bradyreflexia. Pertinent laboratory studies include the following: leukocyte count, 21,000 per cubic millimeter, creatine kinase, 2,000 units per liter. Intravenous access is obtained, and the patient is transferred to the intensive care unit. Which of the following medications would not be useful in managing this patient? A. Amantadine, B. Bromocriptine, C. Cyproheptadine, D. Dantrolene, or E. Diazepam? The correct answer is C. Cyproheptadine. This is a case of neuroleptic malignant syndrome, or NMS. NMS is a rare but life-threatening reaction to initiation or rapid uptitration of antipsychotic agents, especially first-generation antipsychotics, as well as certain antiemetics such as metoclopramide and promethazine. It has also been associated with withdrawal of dopaminergic Parkinson disease medications. Though the pathogenesis of NMS is unknown, dopamine receptor blockade remains the most common theory. NMS has an onset within days to weeks and typically presents with a tetrad of clinical features, including fever, rigidity, altered mental status, and autonomic instability. The mainstay treatment for NMS involves cessation of causative agents and supportive care. Medical therapy is required in patients with moderate or severe NMS. Cyproheptadine is an antihistamine with anti-serotonergic properties used in the management of serotonin syndrome, but not NMS. Serotonin syndrome is caused by the use of selective serotonin reuptake inhibitors, SSRIs, and can present similarly to NMS, making it difficult to distinguish. Serotonin syndrome tends to present more quickly than NMS, that is, within 24 hours, and is characterized by signs of hyperreactivity, including hyperreflexia, clonus, and tremor. Answer choice A, amantadine, is incorrect. Amantadine is used as an alternative to bromocriptine in the management of NMS. Answer choice B, bromocriptine, is incorrect. Bromocriptine is a dopamine agonist used to reverse the anti-dopaminergic effect of antipsychotic drugs in NMS. Answer choice D, dantrolene, is incorrect. Dantrolene is a direct-acting skeletal muscle relaxant used in NMS for reducing muscle rigidity and heat production. Answer choice E, diazepam, is incorrect. Diazepam is a benzodiazepine that can be used to manage agitation in patients with NMS. The key learning point here: neuroleptic malignant syndrome is a rare but life-threatening emergency that requires prompt diagnosis and management. Medications used to treat neuroleptic malignant syndrome include amantadine, bromocriptine, dantrolene, and diazepam. Serotonin syndrome is an important differential diagnosis to consider in patients presenting with altered mental status, neuromuscular excitation, and autonomic dysfunction. All right, that's it for this episode, but please do check out our other episodes, and a reminder that you can find this content and much more at medprep2go.com.